Morning, my name is Maylin Zambrano and I'm going to talk about Isoniazid preventive therapy in HIV-infected pregnant and postpartum women. Definition: tuberculosis is the leading cause of health and death among persons with HIV infections who reside in low-income and middle-income countries with high tuberculosis burden. Among women, tuberculosis predominantly affects those of reproductive age. When tuberculosis develops during pregnancy or the early postpartum period, it is associated with adverse maternal, pregnancy, and infant outcomes.
HIV and pregnancy.
Will HIV hurt my pregnancy?
No, HIV does not directly affect pregnancy, but although it doesn't directly affect it, it is possible for a mother to pass the virus during pregnancy, labor, and delivery, or through breastfeeding. This is called mother-to-child transmission. The smaller the amount of the virus in the mother's blood, the smaller the chance is of passing HIV to the baby. Antiretroviral therapy, often called ART, is the medicine prescribed to people living with HIV. ART lowers the amount of virus that is in the blood. Taking ART as prescribed will greatly lower the chance of HIV being passed to the baby.
Will my pregnancy make my HIV worse?
No, pregnancy does not make HIV progress faster or get worse. However, to avoid transmitting the virus to the baby, it is important for a pregnant woman living with HIV to seek prenatal care and begin antiretroviral therapy to avoid transmitting the virus to the baby.
Does the HIV medicine, ART, hurt my baby?
It is important to see a doctor who is knowledgeable about HIV treatment during pregnancy. An informed doctor will know the medicines that are safely prescribed for pregnant women living with HIV. This will ensure that the pregnant woman and her baby get the best care possible. There is some evidence that the use of ART can increase the chance of preterm birth. It is important for the healthcare provider to be aware of this potential complication in order to monitor a woman's pregnancy.
Application in medicine. In this multi-center, double-blind, placebo-controlled, non-inferiority trial, we randomly assigned a pregnant woman with HIV infection to receive Isoniazid preventive therapy for 28 weeks, initiated either during pregnancy or at week 12 after delivery. Different group. Pros and cons. Pros. Isoniazid, in addition to our ART, is strongly recommended for the prevention of tuberculosis in patients with HIV infection. Cons. Retrospective data from the 80s have suggested a higher risk of toxic effects related to Isoniazid treatment during pregnancy and the postpartum period. And this formed the basis of the recommendation of the Center of Disease Control and Prevention to defer Isoniazid preventive therapy to the postpartum period in women without HIV infection. Issue applied in Ecuador. In Ecuador, the MSP has arranged for the diagnosis of HIV infection in pregnant women in all public sector health units that have a laboratory and in some self-employed. All pregnant women with a cough lasting 2 to 3 weeks should be considered respiratory symptoms and therefore should be screened for the active tuberculosis. Conclusion. The risks associated with initiation of Isoniazid preventive therapy during pregnancy appear to be greater than those associated with initiation of therapy during the postpartum period.